We published 2 of our papers in Lancet Haematology in the same issue. There was I'm the first author of both papers, but in fact, the paper about the B-cell randomization was essentially written by Del Fielding, and that shows that 4 doses of Rituximab does not improve the outcome of pre-B ALL. And I think we have to go back to the GRAL data, which showed that 16 to 18 doses does improve the outcome, and it would seem that 4 doses are not enough. There was furthermore data showing that the critical percentage of cells that need to be positive for you to regard somebody as being CD20 positive is of the order of 11%. And then the second paper, which I led on, was about reduced intensity transplant. And this is the biggest series of reduced intensity transplants ever reported in ALL. So it was 249 patients, and we really got some very good results. This was experimental therapy when the trial began, and we now know that those patients have a 55% 4-year survival, which is really a lot better than chemotherapy. And this was a high-risk group. Nearly half of them had high-risk cytogenetics. We did find, which I've alluded to before, that the patients who were MRD positive, they did much less well than the patients who are MRD negative. At the time of the trial, those patients didn't have access to blinatumomab, so it will be of interest to see if blinatumomab can change that less good outcome. But perhaps those patients need different strategies, such as CAR T cells. And you know, CAR T cells, more and more CAR T cells will be approved in the near future. Within UKALL14, of course, we did a randomization of Nelarabine versus no Nelarabine as consolidation therapy in T-cell ALL. And this is work led by Claire Roundtree. This has been presented in abstract form, but the full paper is being written up soon. And what we did is we just gave 1 course of Nelarabine because there's very encouraging data in children suggesting high-risk T-cell ALL does have its outcome improved by Nelarabine. So what we've done is try to do something similar in adults, although we've given less Nelarabine. So that paper is in the final stages of preparation, and it's something certain to look out for.